Bachelor of Science Nursing Microbiology. Unit 4, Pathogenic Organisms, Gram-positive Cocci, Staphylococcus aureus. Characteristics: Gram-positive Cocci, arranged in clusters, grape-like. Facultative anaerobe, catalase-positive, coagulase-positive. Produces golden yellow colonies on agar. Source: normal flora of skin, nasal passages, throat and gastrointestinal tract. Can also be found in wounds, surgical sites and medical devices. Portal of entry: skin breaks, wounds, surgical incisions. Respiratory tract: inhalation. Gastrointestinal tract: contaminated food. Transmission of infection: direct contact, skin to skin, cuts, wounds. Indirect contact: contaminated objects, hospital equipment. Airborne droplets: coughing, sneezing. Foodborne: contaminated dairy, meat. Pathogenesis: disease, skin infections, pneumonia, food poisoning, toxic shock syndrome, endocarditis. Incubation period: 1 to 6 hours, food poisoning, 4 to 10 days, invasive infections. Signs and symptoms: boils, abscesses, high fever, vomiting, foodborne, hypotension, rash, TSS. Produces toxins, e.g. enterotoxins. Protein A binds IgG. Identification of disease-producing microorganism: culture, blood agar, beta hemolytic colonies. Mannitol salt agar, ferments mannitol, turning medium yellow. Microscopy: gram stain, gram-positive Cocci in clusters. Biochemical tests: coagulase positive, catalase positive, DNase positive. Molecular tests: PCR for staphylococcal toxins, protein A detection, prevention and control, regular hand hygiene and proper wound care. Proper sterilization of medical equipment and hospital hygiene. Staphylococcus epidermidis. Characteristics: gram-positive Cocci arranged in clusters, facultative anaerobe, catalase positive, coagulase negative. Forms white colonies on agar. Source: normal flora of skin and mucous membranes. Common in hospital environments, contaminates catheters, prosthetic devices. Portal of entry: breaks in the skin, surgical sites. Indwelling medical devices, catheters, prosthetic implants. Transmission of infection: contaminated medical equipment, nosocomial infections. Direct contact from healthcare workers' hands. Pathogenesis: disease, prosthetic device infections, catheter-associated UTI, endocarditis. Incubation period: few days to weeks. Signs and symptoms: fever, inflammation around devices, signs of sepsis. Biofilm formation contributes to chronic infections. Identification of disease-producing microorganism: culture, blood agar, non-hemolytic. Mannitol salt agar does not ferment mannitol. Microscopy: gram-positive Cocci in clusters. Biochemical tests: coagulase negative, catalase positive, novobias insensitive. Molecular tests: PCR for biofilm-producing genes. Prevention and control: proper sterilization and handling of medical equipment. Frequent hand washing by healthcare workers. Staphylococcus saprophyticus. Characteristics: gram-positive Cocci arranged in clusters, facultative anaerobe, catalase positive, coagulase negative, non-hemolytic, white-yellow colonies. Source: normal flora of the genitourinary tract. Found in soil, water and hospital environments. Portal of entry: urinary tract, ascending infection. Transmission of infection: sexual contact, linked to UTIs in sexually active women. Contaminated hospital equipment. Pathogenesis: disease, urinary tract infection. Incubation period: 2 to 4 days. Signs and symptoms: dysuria, urgency, suprapubic pain. Common UTI cause in young sexually active women. Identification of disease-producing microorganism: culture, blood agar, non-hemolytic, mannitol salt agar, variable fermentation. Microscopy, gram-positive Cocci in clusters. Biochemical tests, coagulase negative, catalase positive, novobiosin resistant. Molecular tests, PCR for specific virulence factors. Prevention and control, proper personal hygiene and safe sexual practices. Prompt sterilization of hospital equipment. Streptococcus Pyogenes, Group A Streptococcus, GAS. Characteristics, gram-positive Cocci arranged in chains, facultative anaerobe, beta-hemolytic on blood agar, catalase negative, bacitracin sensitive. Source, human throat and skin. Infected wounds, respiratory secretions, contaminated objects, fomites. Portal of entry, respiratory tract, inhalation of droplets. Skin, cuts, wounds, burns. Mucous membranes, direct contact with contaminated surfaces. Transmission of infection, direct contact, person to person via skin contact, airborne droplets, coughing, sneezing, fomites, contaminated objects, e.g. towels, bedding. Pathogenesis, disease, pharyngitis, scarlet fever, rheumatic fever, cellulitis. Incubation, period, 1 to 4 days. Signs and symptoms, sore throat, fever, red rash, joint pain, glomerulonephritis. Produces streptolysins. M protein helps in immune evasion. Identification of disease, producing microorganism. Culture, beta-hemolytic colonies on blood agar. Microscopy, gram-positive Cocci in chains. Biochemical tests, catalase negative, bacitracin sensitive, PYR positive. Serology, ASO, anti-streptolysin O titer. Rapid antigen test, detects Group A carbohydrate antigen. Prevention and control. Prompt antibiotic treatment to prevent complications. Respiratory hygiene and avoiding close contact with infected individuals. Streptococcus pneumonia, pneumococcus. Characteristics, gram-positive, lancet-shaped diplococci, facultative anaerobe, alpha-hemolytic on blood agar, catalase negative, optochin sensitive and bile-soluble. Source commonly found in the nasopharynx of healthy individuals, present in respiratory secretions. Portal of entry, respiratory tract, middle ear and sinuses, bloodstream. Transmission of infection, airborne droplets, direct contact, self-inoculation. Pathogenesis, disease, pneumonia, otitis media, meningitis, bacteremia. Incubation period, 1 to 3 days. Signs and symptoms, cough, fever, chest pain, ear pain, stiff neck, meningitis. Capsule prevents phagocytosis, major virulence factor, identification of disease-producing microorganism, culture, alpha-hemolytic colonies on blood agar. Microscopy, gram stain shows gram-positive, lancet-shaped diplococci. Biochemical tests, optochin sensitive, bile-soluble, catalase negative. PCR and serology detects pneumococcal DNA or antigen. Prevention and control, vaccination, PCV13, PPSV23 to prevent infections. Avoiding close contact with infected individuals and maintaining respiratory hygiene. Pathogenic organisms, gram-negative, Cocci, Neisseria meningitidis. Characteristics, gram-negative diplococci, kidney bean-shaped, facultative anaerobe, oxidase positive, catalase positive. Ferments glucose and maltose. Encapsulated polysaccharide capsule, major virulence factor. Source, normal flora of the human nasopharynx, asymptomatic carriers. Found in respiratory secretions, saliva, mucus. Portal of entry, respiratory tract, inhalation of infected droplets. Bloodstream, invasive infections leading to meningitis or sepsis. Transmission of infection, airborne droplets, coughing, sneezing. Direct contact with respiratory secretions, kissing, sharing utensils. Close living quarters, dormitories, military barracks increase risk. Pathogenesis, disease, meningococcal meningitis, meningococcemia. Incubation period, 2 to 10 days, commonly 3 to 4 days. Signs and symptoms, sudden onset of fever, headache, neck stiffness, nausea, vomiting, photophobia, altered mental status, petechial or purpuric rash in meningococcemia, shock, hypotension, multi-organ failure in severe cases. Identification of disease-producing microorganism. Culture, grows on chocolate agar, Thayer Martin agar, selective for Neisseria. Microscopy, gram-negative diplococci inside polymorphonuclear cells, PMNs. Biochemical tests, oxidase positive, catalase positive, glucose and maltose fermentation. Molecular tests, PCR for Neisseria-specific genes, latex agglutination for capsular antigen detection. Prevention and control, meningococcal vaccination, routine for high-risk populations. Prophylactic antibiotics, rifampin, ciprofloxacin, for close contacts of infected individuals. Neisseria gonorrhoeae, characteristics, gram-negative diplococci, kidney bean-shaped. Facultative anaerobe, oxidase positive, catalase positive. Ferments glucose only, does not ferment maltose. Pili and outer membrane proteins aid in adhesion and immune evasion. Source, human genital tract, primary reservoir. Present in semen, vaginal secretions and infected mucosal surfaces. Portal of entry, genital tract, sexual transmission. Oral cavity, oral genital contact. Eyes, perinatal transmission to newborns. Transmission of infection, sexual contact, unprotected vaginal, anal or oral sex. Vertical transmission, mother to newborn during childbirth. Pathogenesis, disease, gonorrhoea, ophthalmia neonatorum, disseminated gonococcal infection, DGI. Incubation period, 2 to 7 days. Signs and symptoms, urethritis, burning micturition, purulent discharge in men. Cervicitis, pelvic inflammatory disease, PID in women, lower abdominal pain, vaginal discharge, fever. Conjunctivitis in newborns, ophthalmia neonatorum, redness, swelling, discharge from the eyes. Disseminated infection causing arthritis, dermatitis, and tenosynovitis. Identification of disease-producing microorganism. Culture, grows on chocolate agar, Thayer Martin agar, selective for Neisseria. Microscopy, gram-negative diplococci inside PMNs in urethral or cervical discharge. Biochemical tests, oxidase positive, catalase positive, glucose fermentation only. Molecular tests, PCR or NAT, nucleic acid amplification test for gonococcal DNA. Prevention and control, consistent and correct use of condoms to reduce transmission risk. Routine screening and early treatment of infected individuals and partners.